A new and controversial treatment for multiple sclerosis. An Italian doctor believes that he has found a cure for the progressive disease, and it's being tested in the United States. But is it a cure or just sparking false hopes? Health reporter and registered nurse Gorman set out to answer that question, and you now join us.
Yes, and this is a pretty big debate in Canada, also controversial here. It is said to give patients hope, new hope to patients with MS. Of course, it's a disease without a cure. So we followed a few patients and also looked at the science behind the treatment.
There's another one, a silver mine.
45-year-old Sam Fulginetti is a proud father of 5-year-old Hunter, but he says multiple sclerosis, or MS, makes things difficult.
I just don't have the energy.
Which is why he came to the Peripheral Vascular Institute of Philadelphia. It's one of a few centers nationwide offering a procedure some believe can help relieve symptoms of MS. Sam is hoping for more energy, clearer thinking, and more mobility in his hands.
I have just tightness, numbness in my hands.
The procedure is known as venous angioplasty. It was developed by Dr. Paulo Zamboni, who believes the cause of MS is a blockage of blood flow in veins draining from the brain to the heart, also known as CCSVI. So vascular surgeon Dr. James McGuckin opens the vessels. Still, he tells patients it won't work for everyone. In fact, Dr. Zamboni's study of 65 patients shows 1/3 had no improvement. 1/3 saw moderate results, and 1/3 saw dramatic results. It's those dramatic results that make Dr. McGuckin a believer.
We've had 5 people get out of wheelchairs and walk in a week. I mean, just amazing experiences.
Janine Baker of Ontario, Canada, is also a believer. She had the procedure done in New York over a year ago. At the time, she says she was using a walker and a scooter. After,
so my balance improved, my coordination improved. I was able to squat down and stand up again.
So she came to Philadelphia to have the procedure again. She's losing her balance again, so she's hoping clearing more veins will help. But Dr. Stephen Galletta, a neurologist and MS expert at the Hospital of the University of Pennsylvania, warns against the procedure.
I think it's important to emphasize that in the last year, there have been at least 6 major studies from around the world that have not been able to confirm the findings of Dr. Zamboni.
Plus, he points out there has been at least 2 deaths associated with the treatment. We visited Sam and his family about 4 weeks after the procedure. His parents say they've noticed improvements. Sam says he feels more energetic and has more mobility in his hands. This is him tying his shoe before the procedure. This is him after.
I feel like it has made a difference in my life.
Dr. Galletta says symptoms of MS can come and go quickly with or without treatment.
Till we get better evidence, I cannot recommend this procedure to any patient with multiple sclerosis.
So obviously not everyone is in agreement about this. We should mention the patients being treated here locally are being followed by a research foundation. There is also a government clinical trial underway in upstate New York. And we have much more information on 6abc.com.
And with these trials, we'll know more within some period of time.
Exactly. And the preliminary results, I believe, are expected in October.
Thank you. You'll let us know.